First of all, I know Ursula von der Leyen as President of the Commission, very straight person, very level-headed person, a very rational person. So when Ursula makes comments of the kind she's made, I think they're well informed, and I think they should be taken seriously. That said, I think the President of the Commission, Ursula, is very focused on getting these issues resolved, and I think the transparency is important in all of this. And AstraZeneca are engaging with the Commission. That's the way it should be. But this has caused certainly concern across Europe, and I think the fact that Europe engaged with companies, and that was important in terms of the investment into the development of vaccines in the first instance, that I think these pre-purchase agreements that a large entity like the European Union entered into, I think did give confidence to companies to proceed. Also for small countries like Ireland within the European Union, gave certainty of supply as well, and meant that we weren't out there competing with much bigger countries in terms of procuring the vaccine. So all in all, I think the European Commission have behaved well and effectively in relation to vaccine procurement. There are a lot of tensions out there, Stephen, you're correct. A lot of pressure on the Commission from member states, from prime ministers. Why? Because the populations are under pressure. People are under pressure. They witness the impact of the virus on their own lives. It has devastated families, and it has upended economies. And particularly with the third wave and the mutations and the variants, which has caused a new level of uncertainty and a greater transmissibility, all of that is adding to the pressure, which is, I think, a factor in the fairly tense engagement and negotiations that are currently underway.
You would have watched with disdain, like the rest of us, at concerns that this was bordering on becoming another Brexit battle. It almost became about the UK versus the EU, and Boris Johnson's government has been very successful so far in a vaccine rollout. Do you dismiss those concerns that actually this could be another front on the Brexit battle when we thought we'd got over all of that?
I do, yeah. I don't believe this is another front in the Brexit battle at all. Look, to be frank, given the extraordinary progress that has been made in the development of vaccines, we have to acknowledge that, stand back a bit and say, it's been an extraordinary global achievement that so many vaccines against the deadly virus have been developed so quickly. In historic terms, it's unparalleled and unprecedented. What's your next problem? How you develop a manufacturing capacity to produce the vaccines in sufficient supplies, racing against the clock to meet the expectations of populations across the globe. So in my view, it was always inevitable that there would be bumps along the way, that there would be problems in terms of that supply chain of the vaccine, logistics, manufacturing capacity. What's important when those bumps and when all of that happens is that we have full transparency around those. Everyone acknowledges problems can arise, but the relationships have to be grounded and founded on transparency. And I think that is the EU Commission's point. So I tend to believe that we've made very good progress overall in terms of developing the vaccines. There are clearly challenges in terms of getting sufficient volumes manufactured quickly to get out there. Europe is taking its approach under the European Medicines Agency and the authorisation, which I subscribe to. And I would equally support the European view in terms of the interval levels between doses and so on. But I think over time, we will get there. And I think, when I don't mean any lengthy time, I think we have a good pipeline of vaccines coming on stream. And I think quite a number of high quality companies are involved. So I would be more hopeful, particularly as I said earlier, in terms of the higher volumes coming on stream towards the end of Q1 and certainly into Q2 and Q3, which will allow mass vaccination to continue for the first half of the year.